Development of coronary heart disease and heart attacks. This talk is about coronary heart disease and heart attacks. We're going to look at how the heart works and how heart disease develops. The heart needs a good rich blood supply at all times to be able to perform its job effectively. We have three main coronary arteries with other small vessels which branch off, as seen on this slide. These are known as collateral vessels. This slide shows how heart disease develops over time. Heart disease is referred to as a plaque consistent of fatty deposits and calcification. If this plaque becomes unstable, it may rupture and lead to an occlusion of the artery. This is termed as acute coronary syndrome. A heart attack is a form of an ACS, where there is a significant blockage of a coronary artery. There are three main types of acute coronary syndrome. These are unstable angina, non-ST segment myocardial infarction, ST segment elevation myocardial infarction. Unstable angina is where the blood supply to the heart is seriously restricted and may need medical intervention. And NST-EMI is where there is a partial blockage to an artery but is still considered a medical emergency. An ST-EMI is caused by a total blockage of a coronary artery. This is what most people think of when they hear the term heart attack. Symptoms could include chest pain or discomfort, which may radiate to the arms, shoulders, jaw and back. You may also experience pins and needles in the arm or hands. It may also feel very gastric and indigestion-like in nature. Some people may experience shortness of breath and an awareness of your heart beating. You may be pale and clammy and feel nauseous. You may not experience all of the symptoms mentioned, and the symptoms may be very subtle in nature. If you experience any of these symptoms, you should always follow any emergency advice given. One of the tests that you may have had is a coronary angiogram. This is a test that looks at the blood supply to the heart muscle. This slide demonstrates how the coronary arteries may look on an X-ray taken during the angiogram. This slide demonstrates a before and after picture of a patient who has been diagnosed with a heart attack and has had a stent fitted, angioplasty. This slide demonstrates the angiogram and angioplasty procedure. The angioplasty is a technique that squashes the atheroma, fatty deposits, flatter against the artery wall. This makes the artery wider and allows blood to flow through it more easily. In almost all coronary angioplasties, a stent is inserted. A stent is a small metal tube that acts as a scaffold. Some people may need a specialised intervention known as rotablation. Sometimes when the plaque is particularly hard or is so narrow that the balloon can't pass through it, rotablation may be used. For some patients, coronary angioplasty may not be appropriate, so they may be referred for coronary artery bypass grafting. This is where a vein or artery is taken from the arm, radial artery, leg, venous vein, or chest, mammary artery, to bypass the blockages in your coronary artery. The number of bypass grafts you may need will depend on how many of your arteries are narrowed. The coronary arteries are on the outside of your heart, so the surgeon does not need to open your heart.